Hey, I'm Hunter and this is the Emergency View, and today we are talking about B12 and vitamin D deficiencies. I'm joined today by Miss Hannah.
Hey everybody, I'm a PA. I recently graduated in August and I've been working in family medicine primary care since.
Okay, so today we are talking about the role of vitamin D. So can you explain what that does for patients?
Yeah, so the easiest way for me to put it is that it helps regulate our calcium as well as our phosphate. So what this does is it keeps bones, teeth, tendons, muscles, all of those things healthy. And then also what people know about it on kind of a smaller scale is that it helps regulate our immunity and it also helps with mood regulation.
So where does vitamin D come from?
So it can come from sunlight exposure, and that triggers the metabolism of vitamin D in our body. But we also get it from foods like fatty fish, milk, and egg yolks, and then we can always supplement vitamin D as well.
What are things that I should look out for if I was a patient, or maybe if I think that I have a vitamin D deficiency?
So the biggest one's going to be fatigue. If you have very severe deficiency, we can start to see bone or muscle pain. Frequently getting ill, that lets us know that there's something wrong with our immune system, which could be a vitamin D deficiency. And then a lot of mood changes, such as depression, especially if you have seasonal affective disorder. When we're not getting the exposure from the sunlight, we have less vitamin D. So sometimes in the winter months, we start to experience that seasonal depression, and a lot of times we can reverse that with a little vitamin D supplement.
So talk to me about why vitamin D matters in emergency medicine rather than it just mattering in primary care as well.
So it's definitely something that we think about more in primary care than in emergency medicine, but it can definitely come up. Sometimes these deficiencies can worsen, our chronic pain. They can mimic musculoskeletal issues. If you do have low vitamin D and you have, low calcium, things like that, it can be easier for you to get a fracture. That's another way that it can come up. And then also it plays a role in our immunity, like we've already talked about. So it may affect your recovery or may make you more susceptible to infections. So it could be a more underlying cause of why you keep seeing these patients in the emergency department over and over again with these numerous infections.
Okay, and the last thing I've got on vitamin D before we switch it up to B12 is how do we want to supplement a patient with vitamin D?
So the biggest thing before you start supplementing vitamin D is you want to get your vitamin D checked. You want to make sure that it's not too low, or you want to make sure that it's not too high, because it's not a water soluble vitamin like the B12 we're going to be talking about is, so you can become vitamin D toxic, and I don't want to leave that part out. So always get your vitamin D checked at primary care. But most people will start with a lower dose, maybe around 1,000, 2,000. If you're using a multivitamin, you might have like 400 IUs in it. It's not going to do a lot. So usually higher dose supplementation, at least 5,000 IUs a day, maybe even doing 10,000 a couple times a week, or taking a big dose of 100,000 once a week is the better way to get the most bang for your buck.
And I know that most doctors recommend up to 30 minutes of sunlight for each individual. Are you in agreement with that?
Oh, absolutely. Especially if you can get, that 30 minutes as soon as you wake up in the morning. That does a lot for the neurotransmitters in our brain as well, and that further helps regulate, mood and energy, things like that.
Okay. Moving on to roles of vitamin B12. What does it do for our body?
Vitamin B12 does a lot for our body on a microscopic level. So it helps with our DNA synthesis, it helps with our red blood cell formation, and also make sure that our nerves are working properly.
Okay, and what are some primary sources that you can get B12 from just by normal diet?
Absolutely. So like you said, diet's going to be the way to get your B12. Red meat is wonderful, eggs, dairy. A lot of fortified cereals have a lot of vitamin B12 and other nutrients added to it. And then, of course, we can supplement. The biggest thing with B12 that we worry about is reabsorption. So most of the time, if you're having to supplement outside of your diet, you're going to need a sublingual lozenge, or you're going to need an injection, because the oral form of vitamin B is not absorbed in our intestines very well.
Okay. And what about the deficiency symptoms? What do you tend to look at when dealing with vitamin B12 deficiencies?
So similar to D, we worry about weakness and fatigue. And then numbness and tingling, especially in our hands and feet. They call it a stocking and glove appearance. And you kind of start to have that neuropathy going up your feet, up your hands. That would be indicative of a vitamin B12 deficiency, sometimes a folate deficiency as well, but there's, ways that we can distinguish between the two. You can start to have neurologic symptoms such as memory loss or confusion. And, even if we have a vitamin B12 deficiency anemia, we can start having shortness of breath, heart palpitations, things like that, because we're not oxygenating our body correctly.
Okay. And, what do you see day to day when you're seeing patients in a primary care setting with the B12 or the vitamin D? Since we're dealing with a more elderly population, what types of things are you seeing on that?
The fatigue, and just the lack of energy. And a lot of them, they don't eat well. They do not have a well-rounded diet, so I know that these, nutrients that we're supposed to get, we're not getting. And a lot of them aren't mobile enough to get outside and move around, especially as it gets getting colder outside. So those are all just little things that I look at. Almost everybody in our area, if we have fair-skinned, light eyes, you can almost look at somebody and say, I know you're going to be vitamin D deficient.
Okay.
But always double check.
How can we supplement? I know we talked a little bit about it, but we didn't go in great detail. How can we supplement B12?
Yeah, so absolutely. I kind of prematurely mentioned this earlier. Doing the sublingual lozenge or doing the injections are the best way to get your B12. I would not waste my time trying to get it orally, honestly. I know personally I did it for a while orally, and it never moved the needle until I started doing injections.
Okay.
The good thing about the B12, though, if you don't need it and you have too much, you're just going to pee it out and your body's going to get rid of it, so it doesn't build up.
So I know also from looking at, different things, case studies, so on and so forth, that GI conditions definitely play a role in this too, and that if you don't have good gut health, then sometimes it's hard for you to absorb, and it's hard for you to boost those vitamins as well. So what's your take on that? And do you think that those patients are a higher risk for vitamin D deficiencies or B12 deficiencies?
Yeah, 100%, especially on the vitamin B12. If we've had a patient that has a history of like a gastric sleeve procedure or something like that, we always tell them that they're going to be at risk for a vitamin B12, deficiency anemia, and we supplement pretty high dose in patients, from the get-go. We don't wait for them to get deficient. We know it's going to happen. So definitely. And then just in general, like GI health is so important. So this is an opportunity for me to plug one of my other favorite supplements, and that's fiber. Whether you're getting it with a Metamucil gummy or you're doing FiberCon supplements, it's very anti-inflammatory. It's wonderful for gut health, wonderful to keep you regular. So I recommend everybody be on fiber every single day.
Okay. Last little segment, so to speak here. Want to talk about prevention and, what steps I should take going forth if I feel like maybe something like this is affecting me.
So the easiest place to start is go to primary care. We're always going to plug primary care. So go to primary care, get your labs taken. Your supplementation is going to be simple. It can also prevent some long-term complications and side effects, especially if we can catch it early. So start a supplement. Sometimes primary care can write that. You can get it from the pharmacy, but a lot of these you can just get over the counter. You can order them on Amazon. We do have to worry about, regulation and knowing what's in our supplements. So I do recommend making sure that you do your research on the brand of supplement that you're getting. I really like Life Extension. Just from personal experience, they have a lot of data to back it up, so I definitely recommend that one. All
right. Well, this is the emergency view, and if you enjoyed this, like, subscribe. We appreciate you joining us. We look forward to you being on here more, actually. So the next time that you're feeling tired or you're feeling fatigued or sleep deprived, visit your primary care, get you some labs, get a workup, and see if maybe that's affecting you. Thank you.